my name is Brittany Shegley and I'm a student physical therapist from Campbell University. Today I'm going to tell you about O'Brien's active compression test. This test was originally created for diagnosing a labral tear in the shoulder, but they found during testing that it was good for the AC joint as well, the acromioclavicular joint. The sensitivity for the acromioclavicular joint is 100% and the specificity was found at 96.6%. And for the labrum, the sensitivity is 100% and the specificity is 98.5%. This means that this test is both good at ruling in and ruling out AC joint and labral pathology. A few systematic reviews have found that those numbers might be a little bit high, but it's still a great test to use in conjunction with a whole big bag of tools that we have in special tests for the shoulders to look at the acromioclavicular joint and the labrum. For the acromioclavicular joint, the testing position puts the greater tuberosity pressuring the acromion, essentially closing down the acromioclavicular joint, which is up here. And that pressure, in addition to the resistance from the deltoid when you put pressure on there, causes the joint to compress even further, recreating patient's pain. And the positioning for the labrum puts increased shear forces inside the glenohumeral joint, and that pressure on the labrum can recreate pain, and if there's a tear, the patient might feel clicking as well. So on my patient Rachel here, I'm going to demonstrate how you would do the test, so if you wouldn't mind standing up, please. The PT would want to stand behind the patient, and you have the patient flex their arm to 90 degrees, adduct to 10 to 15 degrees, and maximally internally rotate. The PT will then apply a downward force just below the elbow and the patient should resist it. And then you have the patient fully supinate, and then you apply the downward force and the patient resists that as well. So this test is to look at your shoulder joint. When you have pain, there are a lot of different causes that can happen, and one of them is your AC joint, which is right up here. And this joint sometimes gets inflamed or gets dysfunctional, and this test puts pressure on that joint, and that will recreate your pain. And there are also cartilage deep inside, it's called the labrum, and it puts pressure on that as well, which can cause pain or if you feel clicking. So I'm going to do the test again, and I want you to tell me where you feel the pain, if it's on top or if it's deep inside. So I'm going to go ahead and flex your arm, and we're going to bring it over, and put your thumb down, and I want you to resist my pressure. Okay, and relax. When you, initially I would do it on her unaffected arm, and then that way she can kind of feel what's going on, and then I would go ahead and do it on her affected arm. By putting the patient into that externally rotated position, it opens up, so that should make her pain go away if you have a positive test. So if her pain was on top, that would indicate AC joint dysfunction. If she described her pain as inside or felt a clicking, that would indicate labral tear, as long as it got better with that external rotation.